So here we are. Welcome, Merlin. Welcome, Yuki. I'm very grateful you two, who are the experts in the field, have made time to talk with me. The idea of this conversation started with me reaching out an email to both of you with some questions I noticed about Moxa. Yuki had come to Portland and recorded a continuing ed seminar with Blue Poppy, presenting, a short version of Mrs. Koshiishi's ideas on Moxa. And I've been investigating that ever since. And, I had some questions, and that's where this started. We'll get to that eventually. But I just want to start with inviting first Merlin and Yuki, introduce yourself, your history in traditional East Asian medicine, your interest with Moxa, and then after the introductions, we'll go on from there.
You want to go first, Yuki?
Okay, so my name is Yuki Itaya. I live in England, and my training is of acupuncture started when I was quite young, on horses. That was my original training. So Moxa on horses. And I learned this, through the veterinarian in Japan, who does, like fertility for cows, when they do the sperm transfer, they do Moxa on top. That's how I learned. So it was always big miso on top of the spine, which I do now with Koshiishi sensei's style of Moxa, And then, and I've been with, Moxafrica since 2000, maybe 11 or 12. And
as a board member, you're a board member, or?
Yes. Yeah,
we call it, we're trustee, we call him.
Trustee.
We call it trustee, yeah. And the Moxa has been in my life deeply intertwined, with all aspects, and pretty much that's all I do with M test. The Mukaino sensei's M test we call Mukaino method now. Since 2000, officially 2008, but I've been studying his style since 2005. And that is still, my everyday, style of the treatment, and it's been working really well.
So you're using Moxa on the points that you find that are effective points instead of the press.
Exactly. Yeah. So for me, with spinal Moxa and kind of heating up the spine and spinal fluid it's my core kind of a treatment with M test. Yes.
Now you have other background, and have studied some with Junji. By the way, I was in the Seattle seminar when Mukaino sensei came for the first time to teach in the US. And I was his first demonstration patient here.
Yes.
But you have a wide background in Moxa, right? You know Junji Mizutani. Can you describe when you met him, when you met Mrs. Koshiishi, how this came together in your background?
So, Junji sensei, I used to go to his house, almost 3 or 4 years in a row to study with him. So I stay in his house for a week, and then just learned how he does. And he does a lot of back treatment as well, with the bamboo.
Right.
And so I learned his way of style, and I still use it when I need strong treatment. The Junji sensei's treatment come in, and then with needling. And I study with Shudo sensei as well. I went to see Shudo sensei's clinic in Oita, And then I studied with Ikeda sensei as well, you know, and so I have like, I love Japanese acupuncture and moxibustion because, you know, it's just like it covers the wide, you know, the range of, I guess, illness, I think. And then Koshiishi sensei, I met her quite recent. I think it was 2014 in Japan when I was presenting Moxafrica's, you know, our work in Japan. And she came and we got to talk. And she said, come and get the treatment from me because it's very different. So I went to her clinic and then she offered for me to speak as well to her patients and then, you know, many more acupuncturists. And the treatment that I got from her was just mind-blowing. It's like a sunshine on my back, you know. It's like if you can put the sun into the small ball and then you just put it on the spine. That's how I felt. It was an incredible feeling. It was so different. So I started to study with her right away. And then I invited her over to England, I think same year, 2014. And then she came twice to England, one in Devon here, where I live, in the middle of the Dartmoor National Park, which is very remote place. But I think we had 40 practitioners from all over the Europe.
I think it was 14 nationalities. I think I made it. Something like that, 14 nationalities.
There was so many, you know, people came and learned from her. And then we had another seminar in Birmingham with Merlin. And then that was 2016, Merlin?
Yeah, I think so.
Yeah. And that was even bigger class. We had maybe, you know, English and people came from Japan as well. And a lot
Spanish.
of Yeah.
Holland as well. There was some from Holland.
Yeah, and lots of people from Italy, Spain, Portugal, France, you know, that was, I don't know how many people, I can't remember. It was maybe close to 50 or 60 people. It was quite big class. And it was just a very different way of treating people, you know, the Koshiishi sensei provided, you know, which I really appreciate because it's a very different concept, you know. And so kind of like from there, I developed, you know, my style of the moxibustion. So that's kind of like a nutshell, I think.
It's a long journey from big cones of moxa on a miso to tiny cones.
Because I used to go in the mountain and I cut the, you know, yomogi, you know, the mugwort, and then I dry them for like a week. And then I used to like make the big yomogi ball, you know, and then I get the expired miso from a supermarket. And I use that, you know, instead of a shiunko cream. Yeah. And I just burn it on horses. And I have to tell they love it. They still love it. I still do it every week, you know, to few horses here. Yeah.
You tried it on donkeys, Bob?
I did it on donkeys.
Yes, I have.
Yeah, I did it on the donkeys. I did it on the turtles. You know, I tried pretty much every animals. Yeah, not the fish, but
Yet.
Yeah. So the animals, you know, like for me, acupuncture and moxa was for animals, you know, and it was working like magic. You know, they all of a sudden they love me because I do moxibustion for them. You know, they used to kind of you know, bite my clothes when I walk by when they need it. They were telling me, and then you know, I could tell, okay, they're having arthritis or they have a puffy leg, they need that, the blood circulation, yeah, I did like a, hot water therapy, try to help anything. So I was like maybe 13 years old. Then I realized that, acupuncture and moxibustion was for human also. I didn't know for about 5 years it was for human. I thought it was a very specified treatment for animals.
That's cute.
I can remember Junji's telling me that there was some research, which I've never seen published or anything, but it must be in Japanese, I think, about fertility rates with cows using Moxa and not using Moxa, comparative for artificial insemination. So
yeah,
somewhere it's out there.
Yeah, it's very big for the cattle, farmers. They use moxibustion, and then they do, exactly how I did it. Quite, not refined moxibustion, but it works. Yeah, it works for mastitis. Yeah.
Fascinating. Merlin, do you want to go into your background?
Yeah, I haven't got this animal connection, so I've got to try and jazz it up a bit. So yeah, my original training in acupuncture was with the Worsley School here in the UK, and for various reasons, one of which was I don't think I was very good at it. I was kind of, I think I've got to find a better way of doing this. I want to do this acupuncture. I know there's something important here, but I couldn't make the style work for me. And by coincidence, at the same time, Stephen Birch had moved to Europe from the States, and so he was starting to teach in Europe. And I can remember the first workshop I went was a horror diagnosis workshop, and it just blew my brains. I'm thinking, wow, I need more of this, So I started looking at Japanese techniques, particularly acupuncture, not Moxa to start with. Although I know I did a Moxa workshop with him, and the first sort of phase was looking at Manaka style stuff. Which was, for me, was like getting let out of jail, really, because all of a sudden I could treat. I didn't have to worry about the pulse. I just needed to basically focus on what my hands were telling me to do. And then I about 2 years later, I was getting pretty bored of it, really, because it was a little bit repetitive. And at that stage, I took the jump into learning Koshiishi-style, which was, at in a sense, it's the same thing, but in another way, it's something completely different. Again, much more relying on the hand, the touch, but much more subtle and sophisticated, I'd say. But and so really, the link to Moxa. I'm kind of like worried about Moxa. I had a lot of arthritis in my fingers at the time. I was finding rolling small combs actually very difficult. So it wasn't something that I was particularly. I used to use Kyotoshin on the needle a lot, but really not that much rice grain Moxa. And I did some advanced training in Itaya with Steve Birch. And on the last night of it was 3 weekends over 2 years, so 6 weekends overall. On the last, as is the tradition in these things, on the last night you tend to go out and get a bit drunk. And so that's exactly what I did. I got out, and there was somebody was feeding single malt Scotch whiskey down the table in a very expensive bar in Amsterdam, and I was blind drunk. And Jenny Craig, who ended up co-founding Moxafrica with me, was sitting beside me. She's much more wise and sensible than me. She wasn't getting drunk, but the year before, she had said that she'd done 2 projects one in Sri Lanka, post tsunami in Sri Lanka, and the other in India with a Tibetan refugee project I can't remember where, but it's not in northern India, and it's some godforsaken part of India where they were basically really struggling to survive. They'd just been parked there, a bunch of Tibetan refugees, and she'd taken her acupuncture there, and but Jenny had grown up in Zambia and Malawi. Her father was an engineer, and so she'd got Africa under her nails, really. And she said to me one evening on the first year, she said, I want to do some acupuncture, kind of like this project work. I want to do it in Africa. Would I be interested? Would I be interested? And I thought about it for about 5 seconds and then said no. And for the very simple reason that what I could see is something that would potentially be helpful and very beneficial, but I wasn't sure who it was going to benefit more, whether it was going to benefit the recipients of the acupuncture or the administration of the acupuncture, the administrators of the acupuncture. You would go back on the plane on cloud 9, literally, and what they wouldn't be able to leave behind was anything substantial, anything of any duration. So I kind of like, you know, I felt a little bit uncomfortable about it, and I hadn't. The more what I know now is the reasons why, which is in Africa, particularly about cross-infection from needles. That wasn't because I didn't understand a lot of the issues really on the ground in many countries in the sub-Sahara. But then I'm drunk on this last night, and all of a sudden, bam, the penny drops. And the penny dropped because Steve Birch had actually, when he was doing a workshop back probably in about 2001, something like that, he had actually said, he was talking about Moxa and particularly about Tonetsu, about small direct Moxa and Sawada-style. And he said Sawada had used Moxa to treat tuberculosis in the pre-antibiotic era or whatever he had said, but basically he'd use it to successfully treat tuberculosis. And certainly in the book that he contributed to, the Manica book, the Chasing the Dragon's Tail, there's a list of treatment protocols, and one of them there is tuberculosis, pulmonary tuberculosis, another one for renal tuberculosis. So basically it was that much was true. But in the meantime, in the ensuing years between then and must have been about 2008 when we're in Amsterdam and I'm about to fall over, I'd read this book by Paul Farmer. Well, actually, it wasn't by Paul Farmer. The first book I read about him was about Paul Farmer, who you probably know, you know, a major hero of medicine, and who'd worked a lot in the field of HIV and particularly in TB, and was probably at the time the global expert or the global loudest advocate voice for treating drug-resistant TB. So the penny dropped that evening that basically, well, if this Sawada thing had worked before TB drugs had arrived, so back in the 1930s and the early 40s, if it worked in Japan back then surely to God it would work now when the drugs weren't working with drug-resistant TB. Now, I really had not much of an idea about how much drug-resistant TB there was, nor how much there was in Africa, but that was really the seed. And so basically, I managed to find my way back to my digs that night, and I really don't know how. I was very ill. I woke up the following day, and unlike normal episodes like this, I can remember everything the following morning. And I thought, oh shit, I'm in trouble because I've got to do something about this now. So that's really what galvanized my specific interest into Moxa, and it's pretty much driven me ever since. So yeah, and to try and understand the disease, this tricky disease, which is tuberculosis, and that's taken us into all sorts of avenues of exploration in terms of global health issues and stuff like that. So yeah, I think that's okay. Is that good enough against horses? Have I competed?
Amazing.
I'm terrified of horses. I'm absolutely terrified of things. So
shots of whiskey versus starting a child.
Yeah.
So maybe just briefly touch on what got published from your efforts in Africa, if you can do that in a kind of a thumbnail sketch. We ended up with peer-reviewed publication, correct?
Yeah. So basically we did the first thing we did was 3 pilot studies, which were published in Najom, but they were just to tell us whether or not we were onto anything, and we were satisfied from that we were onto something. We did in the end, when I say we collaborated or contributed to 3 randomized control trials. The first one was in Uganda, and the other 2 were in North Korea, which I'll come to in a sec. But the Uganda one was, for ethical reasons, we were only allowed to treat what you would describe as normal drug-susceptible tuberculosis patients. And we used a very simple protocol, just using stomach 36, ashi no sari in Japanese, on self-administered by the patients themselves, alongside TB drugs, and the control group was just the TB drugs. But because the success rate should be expected on a well-managed group, should be 90%, the success rate for drug treatment for ordinary TB. There were never going to be any startling results. But what we saw was improved success rate. We saw faster sputum conversion, which is where you're seeing a bit like the LFT test for COVID, really, where you're seeing evidence of the bacteria being defeated, the mycobacteria being defeated. And we saw improvements in hemoglobin, and there were some improvements in CD4 count, which is the big biomarker for HIV. Although that wasn't statistically significant, to me it looked statistically significant, and that's just down to biostatisticians. You know, mumbo jumbo for me. But basically, so from that we knew we were onto something, but we couldn't shout about anything about MDR-TB. We tried to, and basically the response we got was, you haven't tested anybody yet. You know, how do we know it works on MDR-TB? You know, it's obvious that if it works on tuberculosis, on a tuberculosis patient, and it's about fortifying the immune response, then logically, of course, it's going to. But we were kind of like cut off at the pass by call it what you will. I'd call it a little bit of medical prejudice, honestly. And the only people who took it seriously were the North Koreans. So so Yuli took it to North Korea. The first trip to North Korea, and the North Koreans were basically, they just lapped it up, and they said straight away, we're going to do 2 studies. We're going to do one on MDR patients. We're going to do it similarly to the Ugandan treatment, except that our advice was, don't just use stomach 36. We encourage them to use these 8 points on the lower back, what we call the Dr. Hara loin points or lower back points. And because we've got, you know, it's our evidence base, really. This goes back to research which Dr. Hara did back in the 30s. So they did that over, I think, 6-month period. And simultaneously, they also ran a second study, which was looking at prevention of activation of disease from a latent state. And that gets a bit technical. So let me just stick with the MDR-TB one and give you a picture about what happened. So basically, the results of the study were that their control group had a success rate of, to be honest, I can't remember the figures off the top of my head, but I think it went up from around about 60%, which is roughly the global average success rate for treating MDR-TB. So it went up from around about 60% to, I think, something like 82 or 83%, which is roughly the global average success rate for treating ordinary TB. So that's a huge, huge claim to make. At the same time, the patient group, their average weight increased. The control group, the average weight decreased. The actual symptoms themselves were seen less in or rather, they resolved faster in the Moxa group compared to the control group. And so everything was looking really encouraging. And if you could make a claim, I mean, nobody's going to take that seriously, quite rightly, because it's a hell of a claim to make anyway, but also, of course, because of where it came from. But I'll just touch on the second one, because the second one's possibly even more important. Because what you have with TB is you have 2 states of the disease. You have the initial infection, which goes latent in nearly everybody. It goes latent, and it only actually activates, or they technically reactivates, in about 5 to 10% of people, something like that. So we could say, you know, and the bottom line with TB, which is important to understand, is around about 25% of mankind is estimated to be infected with this damn bacteria, but it's latent, it's in their lungs, it's ready to go, it just needs a little push, and the push will be something that's going to throw their immune system out. So if you can stop that happening, you've cut into the infectious cycle, because if you don't get the active disease, you don't get the ongoing infections. So basically, there's a very cheap drugs for treating TB are very cheap, ordinary drugs. Drugs for treating MDR TB are very expensive and very difficult to tolerate. But there's a single drug for using as a prophylactic. If you've got somebody who is known, you can skin test to find out if somebody's got latent TB, and they basically use 6 to 9 months of this single antibiotic, isoniazid, which is a relatively speaking harmless, by TB standards, it's a pretty harmless drug. By normal standards, it's a nasty drug. So and so they developed they compared a bunch of close contact cases of close contacts of known infectious cases of TB, and they put half of them on isoniazid and half of them on daily Moxa. And at the end of it, there was no real difference between the numbers. And it's the last time I was there, I picked up this data, and frankly, I'm ashamed to say it, but I was actually really disappointed, because I'm thinking, I didn't outperform the isoniazid. And it literally wasn't until I was on the plane back when I realized the potential import of this, because isoniazid is one of the 2 drugs which defines TB as being drug resistant or multi-drug resistant. There's isoniazid and rifampicin. So it's one of the 2 main ones. If you're resistant to isoniazid, then this treatment, this preventative treatment, will be useless if your latent infection is drug resistant or is multi-drug resistant. Statement. Whatever anybody tells you, it's basically pretty much unlikely to be the case. So if we were comparative, if we'd exposed something which was comparatively as similar to isoniazid, then we were looking at a treatment which could be implemented anywhere in the world to help stop a cycle of infection of drug-resistant disease. And to me, that is just immense. And since then, the findings are summarized, because we couldn't, the North Koreans can't publish them anywhere. They're just pariahs. Statement. They gave us permission to share it anywhere we wished. They were totally open about the findings. We know that if they were to, were these patients properly informed about risks of this, that, or the other? Well, of course they weren't. Was there probable ethical approval of these of the study design and things? No, there weren't. We're in North Korea. We're in a country with massive amounts of multi-drug resistant TB, and treatment programs are on their knees because they get no support from the global agencies. So basically, no, they just trying to make things work. And so we know that this is unpublishable in medical journals, but we managed to put it into the European Journal of Integrative Medicine as a discussion piece, and put all the data together in one place, hoping that would actually generate the necessary input for the next step. Which the next step is to basically say, well, these findings are probably ridiculous. Fine. Well, let's test them out in another small study. Let's put them to the test in Kazakhstan, where there's loads of MDR-TB. Let's put them to the test in South Africa, where there's loads. India, China, take your pick. There's loads of much more MDR-TB out there than anybody is prepared to actually admit to. So, but to date, despite the fact there are incredible people working in the field of MDR-TB, including going back to Paul Farmer's partners in health, the Médecins Sans Frontières from Europe. They're amazing people working in the field, apart from the national TB programs themselves, some of which are terribly run in some countries and some of which are much better run. But we've not managed to actually, we put the bait out, and then COVID comes along. So that puts an end to just about all TB programs for a while anyway.
Right. A few clarifying questions there. First, for the viewers, MDR, you're saying multiple drug resistant.
Yeah.
Maybe not all viewers know that.
I'm sorry. And that multi-drug resistant means it's the strain is resistant to the 2 strongest drugs for treating ordinary TB. You normally use four drugs, and your two strongest ones are out, and that means you're in trouble. And that means your prognosis is spectacularly dark.
And so in North Korea, you were training healthcare practitioners because you can't self-administer these 8 points on the low back.
Yeah.
In Africa, you could self-administer stomach 30.
Yeah. Well, we tested the whole protocol in South Africa in one of the pilot studies. We tried to do it in Uganda. It did in very few cases. It took off, but it was regarded as just too tricky. A lot of TB patients have got lots of they've got lots of challenges in their life apart from being ill with a horrible chronic disease. But in South Africa, they were getting good results with some MDR TB cases, which it was a project in a township, and who were also HIV infected as well. Of course, North Korea probably hasn't got much in the way of HIV, so that wasn't. But that's a real serious confounder for treating TB, and increases the risk of MDR TB. So yeah. So that's I should have explained that about the definitions and things. There's an awful lot of technical information which I just assume people know now. So yeah.
And they were using Moxa imported from Japan, or they're using the Moxa from North Korea?
We always for the studies, for all of the studies, we used. I've got a box of it under here. It's the green box stuff. What's that? What's it called?
The Shirafuji.
Hang on a sec. I'll get the box.
The sending one. It's the gold Moxa.
Yeah, I have it here. I can show it for the camera.
Yeah. And because we knew we were likely to get asked all sorts of awkward questions. All of the Moxa we used was also pre-Fukushima. So just in case anybody accused the stuff we were using as being tainted, or too many becquerels being, or whatever. So it was literally all the same stock. And as you probably already have anticipated as well, there is a degree of antipathy between the Korean peninsula and the Japanese archipelago.
Yeah.
And then on top of that, you've got the North Korean angle of the political sensitivity things. So actually bridging that gap actually was something of a diplomatic triumph, which you got to give Yuli the credit for. He broke those barriers down, and they were quite happy to listen. Whether it would have been the same if say for instance somebody actually native Japanese had walked in, it might have been harder for them, but for Yuli with his charm and his communication skills, he's astonished how that first trip, the work that we'd done in Africa was always below the radar. We were dealing at low level with semi-skilled health workers, all big hearts, but far from highly trained. Yuli goes in there and he's dealing with the senior, a minister of health, minister of public health, and I would have melted on the floor and probably wanted to run away. So it was really quite something. We've lost contact since COVID. We've lost contact completely with them, but so yeah.
It's quite sensitive topic, isn't it, in Japan about North Korea?
Very.
Yeah. I have quite a lot of the negative comments about our work when I present North Korean data. And in Japan, like a lot of people, acupuncturists, they're face to face to me and said, how are you helping them? Why you are helping them? And it was really hard for me to understand that, it's just that in their mind, it's still kind of like, the war going on between Japan and North Korea, and then it was harder for Yuri to grasp and understand or accept it. He was never shy about, speak up about, about the, everybody deserve the health care,
Yeah.
Yeah.
Yeah. It's funny because, my experience with North Koreans is in so many ways, they're so similar in terms of their humanity, their general humanity. They're so similar to Japanese.
Yeah.
Very, very easy to engage, humorous people, warm people. There's so many similarities. And I'm not going to quote who told me this, but because he might not appreciate it. But somebody said to me that because there's waves of immigration into the Japanese archipelago, displacing the indigenous people in the islands. And he said that if you actually did a genetic test of the Emperor of Japan, you would find that he's probably 95% Korean. And that's probably a very, very, very controversial statement to make. So I'm not going to tell you who told me that, but it's so sad and so ironic that there's this. I mean, there is on both sides. There's antipathy. There's, and again that's kind of like kind of bridging that, even if it's only in a very limited way, bridging that with stupid old Moxa. Is kind of like it's something to be smiling about.
It's amazing, isn't it?
Yeah.
As I understand it, Sawada learned Moxa in Korea, isn't that correct?
Yeah, I understand that's true as well. He was a bodyguard, I think, wasn't he?
He was a martial artist bodyguard.
Yeah.
Amazing.
And I think that it's interesting because I think that the Sawada style has gone back into Korea. There's what's his name? He died last year, didn't he? The old Korean guy.
Yeah, the constitutional type.
Yeah. What's his name?
Yes.
Yeah. I can't remember what his proper name is, but he's got Wudan or something like that. I should know his name. But the style he was using is very plainly it's Japanese. So I think there's been a sort of two-way crossover. So it's interesting, isn't it?
Let me jump in with a little of my background. I'll be brief. It's nothing like you guys, but when I arrived in Portland to attend school here, within a week or two, I was so disappointed in the basic TCM education. And if I had the money to go somewhere else, I would have just left school and gone. It was philosophically not what I was looking for. But I went to the HIV clinic that Subhuti Dharmananda had started. And I had read some of his articles before starting my education. So I said, can I volunteer and be a Moxa helper? And so every Friday for 3 years, I went there and did Moxa on the HIV patients. Well, for us, that was just a smokeless Moxa cigar, right, a Moxa pole. And but even that, which is a fairly crude way of doing Moxa, and it's not high quality Moxa plant in those products, even that, many of the HIV patients told me, this Moxa works better for me than the needles. They were mainly contending with was side effects to their medications, many of which gave real GI distress, right? They had bloating and loose stools, that sort of thing. So early on, I was just jumping in and seeing the importance of Moxa. Occasionally, they would allow us to do, a big Hershey kiss kind of Moxa on CV12, something of that sort. So at the training at OCOM itself, we probably had 2, 3, or 4 hours in an entire 3 years, with summers were not given off, probably just 2, 3, or 4 hours of Moxa training in the entire training program. It was, in retrospect, looking back, it's depressing that such short shrift was given to such an amazing therapy. And I graduated, and right away, so I graduated in October of '98. January, I started to do training programs in Seattle. that's when Stephen Birch had just left. So Stephen Brown had stepped in.
Mm.
And other people taught the Manaka stuff, right? Brenda Lowe and some other people, maybe you know. Dan, this is also Toyohari. But Stephen Brown had 8 days of Shudo style radiant therapy. He also taught Sotai, and Kaio King and Brenda taught Shonishin. So I had some basic start in Japanese stuff. At that time, there were only 3 people in Portland, I being one of them, who doing anything Japanese. Kuwahara Sensei had 1 student here, and Kiko Matsumoto had 1 student here. So there are 2 people plus me. So they couldn't help me. It was a moral support that they were doing something Japanese, but no one could help me clarify Sotai or Shudo style or anything like that. So progress was slow. In 2004, well, it took 13 months off, 2003, 2004. In that time, I met Shudo because he came to Seattle. So I had a chance to study with him, see how good was, which was very good. And met Junji at that seminar and asked him to come to Portland because Shudo Sensei allowed Junji 2 hours to teach his style. And then he allowed Jeffrey Dan 2 hours to teach. That was the first time Jeffrey taught his Koshi balancing.
Oh, wow.
And so I met both Junji and Jeffrey there. And just a few months before that, I met Peter Thompson, who was my main Sotai teacher. So it was in bringing Junji to Portland, maybe a year after that. And then again, and we brought him every year, sometimes twice a year. He got a little bit tired of coming. He's like, I think I've taught everybody in Portland. But he was a major influence on how Chinese medicine was practiced in Portland. We got over 800 practitioners in Portland, I think more than any other city in the US. And a lot of those people were, they have been students of Junji's at one seminar or another. And I think it was really the second time he came that I just saw I have to bite the bullet because I was just so embarrassed how clumsy my hands were. It just, and I just made the determination, yeah, I'm embarrassed by the clumsiness of my hands, but I'm just gonna do this every day. And, you know, lo and behold, you know, after a few months, some skill starts to come, and I'm still not a hot shot in Moxa, but I think virtually every patient, I use Moxa, and I can see in the pulse what it gets me, right? And I can see in, you know, symptom relief, what it gets me, and so on. I did want to mention, Merlin, that when you're talking about these 8 points on the low back, just for people listening to this, you have a YouTube video where you're demonstrating this in Australia, how to find these 8 points. And if people just search under Dr. Hara, eight low back points or something like that, they'll find a diagram. I can probably attach it to this recording as well when we put it up on YouTube, just so people know how to locate those 8 points and so on. And then the other part of my Moxa history to mention is Yuki. Yuki was maybe a few cohorts behind my cohort at OCOM in the doctoral program. And I arranged for Stephen Brown to teach. You know, they actually had asked me to teach, and I said, no, actually, you should probably have Stephen come and teach. And we went out to dinner and then stayed loosely in touch. And, you know, when I was in Israel teaching, Yuli was there with me trying to generate funds for Moxafrica. And so these connections over the years. But I became very fascinated with this story of Mrs. Koshiishi. And so I talked you into filming this continuing ed course with Blue Poppy, and I was your model for doing the demonstration of the techniques. And there were a few students who I brought in to view that, and they became big advocates for this in the NUNM clinic where I was at the time a full-time teacher. And I remember, I'll just talk this one case because this will then lead into the question I had initially in my email to you guys. This was a person, his health insurance was paying for him to come to the clinic. This is the college clinic. It's actually a university. And, but he had not benefited at all for 2 whole years. You know, they're just, he had torn up his right knee in a motorcycle accident, right? A number of surgeries. He was morbidly obese, but he was delivering packages for some carrier, I don't know, UPS or something, FedEx. And he had to go up and down stairs, and it was excruciating. And he was spending his whole life in pain, and his family relations had degenerated because he was miserable. He was in pain all the time. And so I said, well, why don't we do this Mrs. Koshiishi technique where we didn't do the bigger cone. We just did, you know, his knee is probably this big. Like I said, it's morbidly obese.
Wow.
And there were scars on the yin compartment and on the yang compartment. Other than adding bleeding to his treatment, all we did is we did this local Moxa. I mean, we probably did like a basic idea of a meridian therapy root treatment. But we did, you know, there are probably easily 50 Moxa locations, right? If you're counting the inside and the outside of the knee. And we would reload them, you know, maybe do 2 on each, occasionally 3. But it was hard for the students, you know, they didn't have great manual skills. It was almost no time before this fellow started to report the most incredible changes in his pain. It was like, it was just going. And he was able, you know, they had, his employer set it up so he only had to go up, you know, 3, 4, 5 steps. They gave him a route where he didn't have to go up to the 2nd story, that kind of thing. But now he could do that and without any pain. And on his own at home, he suggested the family go to counseling because he wasn't in pain and he wanted to repair all the relationships in the family. And I oversaw maybe 7, 8 treatments, and this all happened in that time, coming once a week. And I thought, you know, this is really something. I don't know if this would have happened if I had done any other kind of Moxa, because if I had done, you know, the style like, you know, Junji's bamboo tube, I certainly would have done 50 points. I mean, they were as tightly packed as our fingers could possibly accommodate. And the odd thing about that technique is almost as soon as you light it, you're putting it out with your finger. You know, as you said in the trainings, like 10, 15% of the material gets burned. Occasionally they would feel heat from the incense stick, but they never felt heat from the Moxa. And I'm thinking, I don't understand. I just don't understand. And that's what sent my mind into other things like, is this plant spirit medicine, or what is going on with this stuff? Is it is it the dangui and the lithospermum and the shunko being activated? Are you getting an herb effect? And it's not. I just had all these questions, but here's where it came to, and that I still had this question: is that at the end of a treatment, especially right after the Moxa was done, I did not like his pulse quality, right? And in my email to you, I pointed this out. The same thing would happen. You know, I spent 10 months studying with Dr. Zhu Mingqing, the famous scalp acupuncturist in San Jose. The same would be true. Before the patient was treated, I'd sneak over and feel the pulse. He would treat and they'd get walking again for the first time in 3 years, and then you feel the pulse. It's terrible. It's like it's like a heroic medicine, right? He had kind of bullied their system, their nervous system, into walking again. And I always was wondering, isn't it possible to get him walking again and have a little bit happier pulse? And same with the Koshiishi. So Yuki, you had an idea about, and I was very honest saying that I didn't start by, doing the larger cone technique on the spine. Maybe that would have been enough, that it would have been a different situation so that the pulse after the local treatment would have been better. All those things. I've only recently begun to experiment with treating some patient's spine with that larger Moxa cone technique. Anyway, I'll let you jump in, Yuki. You had some ideas about that can clear up my confusion.
So this is just my, opinion. One is my opinion, and then the other, there's a two theory. And so I will just share with one with the Koshiishi sensei thinks, which is the it's the receptor in the skin. They receive the treatment when it's not hot, which is like 38 to maybe 40 degrees. Then there's a cell receptors in our skin. It's open to healing, so it's like, when you go to Japan or anywhere that it has the onsen, the hot springs,
Yes.
It's really comfortable, not too hot, but you can kind of like stay long time.
Mhm.
That's the healing, the method, especially in the Beppu, in the Oita, where the Shudo sensei is from, is very famous for the therapy, or so that is the temperature receptor on the skin is they're favorable, very small, range of the temperature between like 38 to I think 42 was. And then Koshiishi sensei brought the machine from Japan to check everybody is not burning more than, the temperature, because that is, you have to aim the skin receptor to be, open to receive the treatment. So I think that is the thread moxa which you did for this patient on the knee, and then that opens up the whole, kind of like a healing, his body was receiving the treatment very favorably, and then. And I believe that as well, so I use that theory, but also my personal crazy theory, just learning from horses and just observing the nature, is the photosynthesis. I think I shared a little bit with you, like in the morning, maybe like here's like maybe 4:30 right now, when the sun comes up and all the birds start like singing, and then you can see all the plants are like, they're like during the night, they're like going down. But soon as the first wind, because when the sun comes up, it creates the big wind, it changes the atmosphere. And then all the plants just look up, and that's when where the moxa we use, which is the back of the yomogi, mogua leaf, all those hairs, they stand out to go to push the leaf towards the sun, and that is that I always thought, creating the fire is incense, which is the sunshine. You're burning the moxa, you're like kind of creating this morning chaos of this like a life, coming alive again every morning. So I've been saying that for a while, but nobody believes me. So this is just my theory, but I feel it's kind of like a nature. And then the moxa we use is from Niigata, which is, they are buried in the snow every winter. For them to survive, they have to have so much hair in the back of the leaf. And then harsh winter they go through, they get more hairs. But that's like how much the life force you have. And we are using just these hairs to treat patient, you know, and it's almost like you're creating this like photosynthesis on the skin, you know, you're just like putting the like fire close to your skin. And then it's like, you know, it's kind of awakening up the life force again. So I see that in my treatment every day, you know, this theory is, and then, you know, like you said about the pulse goes crazy. You said you don't like, it's kind of a, you know, very, very, you know, unbalanced pulse you get, you know, and I see this in animals, you know, after I treat them, they just walk away when they're done and they shake whole body. They have to shake it off and they go like, you know, and then they start becoming normal again, but they have to have this like weird shake of it's kind of like, you know, thunder going through their body, you know, they have to shake it off, kind of like the trauma they just happened to their body, you know, the shaking, and then shaking the body. Actually, they're shaking their hairs to release the tension. And then a lot of my patients, you know, pulse becomes maybe crazy, but usually 12 hours later, they start feeling the effect. So I think your pulse going not so balanced, meaning something's really happening. It just takes hours to balance. And it's usually, you know, like I noticed that like older patient, it takes about 24 hours, but younger they are, the life force is stronger. It just happens, you know, lots of kids just go like, and then, you know, it's same as animals, you know, which is, I thought it's really interesting. So, and also, you know, like how Moxa's like, we say, Q is like a fire, isn't it? So like Moxibustion itself is like a fire medicine. It's completely different than acupuncture, needling, you know. And then as far as I understand is Moxa is older than needling. Right. And then this, I think when I do the spinal treatment, I'm telling the patient slightly now, it's a stem cell treatment because, you know, I'm activating stem cells through fire, you know, and then the heat is moving their spinal fluid, isn't it? So it goes to the brain. So their brain, they get tired after the treatment. It's like, you know, you just have to sleep because your brain goes like, you know, reboot, you know, it's like computers going off and then starts up again. So when you treat the spine or anywhere has like a cartilage, I think actually you are stimulating the stem cells. That's my theory. Crazy, isn't it?
And now I want to let Merlin jump in and piggyback on that with any thoughts you have.
Well, I don't know, but I'm interested because I thought just before we started, I thought I want to get myself prepared. And when you said about 38 degrees, it rang a bell for me, and I'm going to be able to find it because I can put a bit of science in it, I think, which is that, let me get it right, hang on a second. It's about transient receptor potentials, TRPs, or TRPVs, I think they're transient receptor potential vectors, I think is the proper one. Yes. And they're in the beneath the skin surface, sensory receptors, and they trigger, there's at least 3 of them, because those are the only ones I know about. There's TRPV 1, 2, and 3. And TRPV, let me get this right, TRPV3 triggers or operates in the temperature range of 39 to 42 centigrade, that is obviously, and is also activated by borneol, which is the most abundant chemical in yomogi or in moxa. So there's something going on at these low temperatures, and there's higher ones. TRPV1, which goes between 42 and 52, and I think TRPV2 goes above 52. So that's a pretty serious one, I think. So there's something going on with TRPV3, which is supportive of exactly what Koshiishi Sensei is talking about, I think. But there's so it's mild warmth that is triggering some cellular response, and these TRPVs have systematic effects on the immune system, amongst other things. That's known. It's known about. It's not brand new research, but it's fairly recent research. It's something that Jenny Craig had sort of uncovered for us some years ago. So, but the other thing that occurred to me is when with the knee patient, I'm just throwing this in just to really confuse the issue, is in my experience, if I've got a knee patient, I feel the knee and the knee's hot. So actually, I'm wondering whether actually at 38, it might be cooler. So it might be desperate. This knee may be above temperature. It can't get to this temperature range for TRPV3 to activate. So there might be something really weird and cooling going on with the Moxa, but I can't imagine, I can't quite figure out how that could physically be happening, because if you're adding heat to heat, it strikes me it's going to get hotter.
But it gets cooler when you do the thread Moxa.
It does.
Like,
you know, you're absolutely right.
Yeah.
And my normal explanation for that, because we all have our own little explanation things, is that it's flushing, and so therefore it's getting some of the heat. The circulation's improving, so it's taking some of the heat out. So, you know, but this is unknown, totally unknown for me. And then another thing I thought of while you were talking was that I have this idea that, which is something I explained, my little stories I explained. We all have stories which we explain to patients. We don't necessarily believe them totally, but, you know, we know they help us, they help. But I kind of believe this one, and that is that, generally speaking, the sequence of Japanese, I think Japanese Akimoxa generally is you do a root treatment first and then you do the branch treatment afterwards. And it's interesting because it reverses with the Worsley style. They used to do it the other way around. You do the branch treatment first and the root treatment afterwards. Is that important? I don't know, but I suspect it may be. But if you are missing out the root treatment, which in a sense you may have been doing with this knee, then my picture of the two is the root treatment, we're setting up the tide. It's like this is like a maritime image. We're setting up, I've got a picture of a beach. It's in South Island, in the southwest coast of Ireland. I know exactly where I am. The tide's coming in. And so with the root treatment, we're setting the tide. So the tide's coming in, but it comes in slowly. But the root treatment, but the branch treatment, we send a wave up the beach. So if we get the wave up the beach, which is a symptomatic part, we bring the tide in behind, and then it holds the wave up there for longer, and it potentially could take it up further as well, all nice and gently, you know, nothing too dramatic. So if you adjust, I'm just wondering whether this would possibly, this is just an idea, potentially explain that a part of this chaotic pulse sort of picture as well, is that actually if you don't bring the tide in behind, then what the hell's happened? We've got some rogue wave coming up the beach. This is weird. And so the pulse can't figure it out. And I think that what you describe in Yuki with the shaking with the horses is phenomenal, because that is an instinctive response of any flight or fright, whatever, you know what I'm talking about, fright or flight animal. After it's been spooked by something, it goes away and shakes, doesn't it? And then it's back to, now I can graze grass again, you know. So but I'm really shooting in the dark here. I don't know.
Yeah, some people call that an autonomic nervous system discharge, right?
Yeah.
Reset the ANS. Well, all those are possible. I noticed the same thing in the pulse, though, with multiple cases. Anytime I would do, and I do a root treatment, and also I've studied the Nagano style with Shimamura Sensei, and he introduced me to Nagano's ideas on the so-called stomach chi line treatment, a bit different than how Kiko Matsumoto presents it, because Nagano changed his ideas about that treatment in the last few years when Shimomura was with them. So I have kind of, in a sense, almost like a double root treatment. You know, I'll do the meridian therapy root treatment. And there's something that happens with the pulse. I like Yuki's idea that, you know, if I check their pulse the next day, I might be ecstatically happy. And that there's a temporal element here. And
there might be the reverse with the more coherent sort of meridian style. If you checked it the next day, you might be very unhappy.
Yeah.
Where you were unhappy after the treatment the first time.
Right. Yeah, people always ask that when they're in a meridian therapy training, you know, how long will this beautiful pulse hold? And I say, well, you know, I can't follow them home and check their pulse every hour and, you know, be a stalker, you know, so I can't answer that question of how long it would hold. I know people who say were treated by Yanagishita, they check their own pulse, you know, for days and weeks, and it remained altered, right? So those beautiful meridian therapy masters, you know, they were capable of producing real magic with a needle. It is true, Yuki, by the way, that in the Ma Wangdui scrolls, you have Moxa, but no needle.
Yeah.
And no points either, and only 11 channels to work with, not 12. So I often tell that to patients, that actually, if I had to pick one therapy, if you choose me to pick between needles and Moxa, I don't need 2 seconds to think about it. I'm taking Moxa. I think I can do more with it. I can help in many different situations. And yeah, if you were someone like Yanagishita or Shudo, probably the needle's more useful for them than the Moxa, but I'm not Superman. And for me, with my current understanding and skill set, I at this point in time, I would choose Moxa if I had to choose. But yeah, in the Ma Wangdui scrolls, you have sets of symptoms leading to certain meridians. And then you have to assume they were palpating. Where the heck did the Moxa go? There were no points, right? So you have to assume that in those early days, Moxa really was quite a hands-on medicine. And were they palpating for tender points? We just don't know, right? We just don't know. Was it gentle? Was it rough? And so on. So let's talk about Shunko.
Yes.
So a lot of people have noted that if you're going to design a salve for use with Moxa, you probably wouldn't come up with Dangui and Sutsaogun, right? Lithospermum and Dangquai or Dangui. This is, you know, it makes more sense as, you know, treating a kind of dry eczema, something like that, which it certainly is good for. But that its main quality is it's red and you can see it, right? So you can, you know, put a little bit on multiple points and you can see quickly, I need to put Moxa on all of those. So it's visibility. And in Japan, you can buy it, I think, almost anywhere, right? In a pharmacy. Yeah. So it's universally available, which is not the case here. Now, Blue Poppy, like 20 years ago, Bob Flaws got, he's long since gone, by the way, but he got irritated by people using Shunko, came up with his own cream that had like black pepper in it and ginger and, you know, more activating substances. Nobody bought it. The product died within a year. First, you couldn't see it. It was the same kind of color as Vaseline.
Yeah.
And I know some people do use Vaseline in Japan. I studied with one guy in Tokyo who used Vaseline and was a hospital-based moxibustionist.
Yeah.
So this whole idea of, I know some people, there's a company in China, they make little wafers. They're kind of pliable, kind of the consistency of Romania, like a chewing gum that's been chewed a little bit.
Mm.
And there are different herbal ingredients for different indications. So a women's health wafer, and you do Moxa on that. So other people are definitely working on alternative sale. You mentioned using miso, right? And so on. But give me your thoughts on shunko, because I know Mrs. Koshiishi must be using a heck of a lot of it.
So I had this conversation with Koshi sensei about, because shunko is quite expensive. So I make about 2 kilo of shunko, like my version of a shunko cream at home every few months for my clinic. And mainly because I just needed something between the skin and, the moxa. So I asked Koshi sensei, does it have to be shunko? And she said, no, and then, but she said, it's very useful. The color is very useful, red, So she made this moxa balm, Okyu balm, she calls it. It's not shunko anymore, but it's pink, and it's red. It's easy to see on anybody's skin, but there's no dangue, anymore. And it works, so because
what's in it?
well, there's an olive oil, and it's called the benihana. It's like a red, it's just a food coloring red, but it's a plant, but it's not Chinese medicine that we use a lot on the lipstick, and then she used I think beeswax,
Right.
and because my recipe is like, so dangue, local bee honey, beeswax with shea butter, with organic sesame oil, and I make it because I need a color on it, and that's and it's not making anybody's skins, and it's good for vegan as well. Maybe beeswax is kind of questionable, but we don't use the pig lard. And so Koshi sensei has her version of cream now, which has no original, Chinese medicine in it, but it works still. So it could be anything, it could be, the Vaseline's like maybe not so good when it gets melt on your skin, but miso could be okay still, yeah.
So Merlin, earlier you had talked about the borneol that's in the moxa, and that having a barrier of some sort might prevent its transdermal movement of plant constituents from the mugwort. Can you go into that a little bit more? Because let me as background say, one of my teachers, like Kuhara sensei, who trained in Taihari, he said Kodo Fukushima always told him, don't use shunko, just use water. He hasn't changed that since. He has a low opinion of using shunko because he trusted the subtle perception of Fukushima.
Yeah. Well, all my reservations are specifically Moxafrica related, and with Moxafrica, what we're trying to do is stimulate an immune response in the patient. The logic behind what we're trying to do is we're trying to push a disease out from within by strengthening the immune system. And if there's a sign that's doing that because there's a CD4 or CD8 count or something that's changing, then we've got an idea that that's happening. So what I can't say with all confidence, but what I'm pretty sure happens is if we spoke to Junji about it, I think you'd be talking about a parasympathetic response induced by the Moxa. And that's because there's mild temperature in the Moxa. If we were to really hit the patient with really hot Moxa, we'll get a sympathetic response. But the parasympathetic response provokes a rebalancing, a resetting of the immune system. If it's in a sympathetic state, then it rebalances, and it tends to promote the proliferation of lymphocytes. And lymphocytes are the sophisticated part of the immune system, the acquired immune system. So there's that aspect, which is just grossly, we could say, temperature related. And then you've got this aspect of the TRVPs, these transient receptor
vectors.
Yeah, vectors. Yes, thank you. and they're working in two ways. One is the temperature ranges, and the second is the chemicals. So capsaicin, which we get from chilies, that will absorb through the skin, and it will stimulate one of these TRVPs. And we know that this borneol, but the two dominant chemicals in mugwort, and as you know, I have it on better authorities than I have, 192 chemicals found, of various proportions in your average mugwort plant. Leaf, stalk, I'm not too sure, but basically 100, just stick with 192 chemicals. The two dominant ones appear to be borneol, which we know activates one of these TRVPs, and the other one is cineol. And cineol is what makes the mugwort fragrant. So basically, if you open your Moxa and you get a really nice fragrant smell of it, then that's regarded in Japan traditionally as that's got a lot of cineol in it. And obviously that's a higher quality Moxa as well, generally speaking. So cineol also, and I can't off the top of my head tell you which one of these TRVPs it activates, but I understand that it also activates another one. So we've got a potentially very complex set of mechanisms going off. The temperature of the skin may well be above 42, maybe above 50, but the temperature in the epidermis below will be building up, depending on how many cones we're doing, one after the other. It's building up the temperature in the skin to these levels of that will activate by heat. Now that'll happen with the Shunko cream, although it might reduce it so we can get away with bigger cones, which is what Shunko does, which is what Koshiishi sensei does with the root treatment. She's using big cones on big lumps, so it's a mild heat, but it's going to block the chemical completely. So from a perspective, and this is not a perspective as Koshiishi sensei's basic global treatment, this is just from the perspective of let's try and stimulate an immune response here. Then basically I'm hanging on to this idea, don't put a barrier between the Moxa and the skin, because if you're doing a daily treatment, then you're going to get if this is hour 1 and this is hour 24 before you get the next one, and this is the dosage, originally you'll get a dosage of heat that will come and that will die away, but after it you'll get a chemical aspect, and this will be complex because it could be activating and with the TRVPs 2 or even 3 of them at the same time, all having potentially systemic effects, and then they both will dwindle away. But if we just rely on the heat, what we'll get is we'll go whoosh and we get nothing for the rest of the day. But with the chemical, hang on, where's my pen gone? We go whoosh, and then along we go, when we come along, and then we potentially still, and then we get the next one 24 hours later, and we're getting a lift. So that's my kind of like simplistic model about what may be happening. And if we put Shunko in the way, if you put something else in the Shunko that's going to absorb, different story. But what are you trying to do? In which case, what do you want to put in the Shunko? So
that's the obvious question. What about putting mugwort in your Shunko?
Yeah, well, there is this stuff in the marketplace which is called Moxa Balm, Moxa Cream. And here in the UK, I know for a fact it's caused problems because it's meant to have some similar properties to applying Moxa, but some acupuncture, I know this for a fact, some acupuncturists here in the UK have assumed it's Shunko cream, have used it, put Moxa on the top, and it's boiled this stuff and created blisters.
Yeah.
So there's a potential big problem with,
Yeah.
unless it's very clearly spelled out. It plainly isn't spelled out in the people who sell it.
Yeah. This is why the beeswax is very
Yeah,
good.
beeswax
because
got a very
they cut
low
that.
boiling point, hasn't it? I think.
Yeah.
Yeah.
So
And I think
beeswax
sesame
is
oil is the
quite
same.
important.
Yeah.
Yeah.
So I know there's been claims here in the UK with this, and it's just a simple misunderstanding because, again, comes back to your point, Bob, because Moxa is so appallingly taught. You know,
Yeah.
same, I hear it, 4 hours, 3 years, 4 hours. You know, we were told, oh, it's so important, it's so important. And they give you 4 hours of training in it because nobody understands it, you know. Very sad.
Yeah. You know how, like, you know, lots of Japanese practitioners, you know, including Hara sensei, you know, how people just doing the stomach 36 and they lived like 100, 120. And their moxa was, I think, a lot higher. The temperature was a lot higher than 38 and 42 because there's a blisters, you know, and why that worked, you know, and that was my question.
Yeah.
And then
if you go, sorry.
Yeah, then I just saw, you know, okay, it's the stem cell, you know, because it's the high temperature stem cell have to be, it's almost like you kind of have to have like a bit of a tap on the spine or on the knees where the cartilage, where the joints are, you know. So when it's really hot, you know, we always say tap it, you know, and tap and, you know, extinguish the moxa. But I think the key is fire. You have to use the fire, and why mugwort, you know, and not the mugwort's leaf or stem. It's just the hair. There's a reason for it, and then because they're the one, you know, stands up, you know, in the morning. They're the one that it really, you know, keeping the plants warm and then protecting. And then
I can remember something from when I was researching it, the sort of aspects of Japanese moxa, that under a microscope, the best quality mugwort came from leaves. The best quality moxa came from leaves with very uniform hairs on the underside when you looked at it under a microscope. So I can remember that, very uniform. So I can, this kind of like, it resonates for me, this idea of the hairs. Yeah, and they have an energy of themselves in it, there, which is activated by the warmth. Yeah,
there's a secret in those hairs, and then they have to burn it. The skin, you know how skin can see the few colors. There's a study, they can, you know, they can differentiate the colors. They have to see that either sunshine, you know, because that's how we make a vitamin D, you know, and then the fire, like, you know, gently, safely comes to close, and the bond is mugwort, and then somehow mugwort is the queen or king of the herb or plants for longest time, isn't it? You know, it grows everywhere, almost every continent, you know, and then it's very easy. They're really like strong plants. And then how these Dr. Hara and, you know, the other people who was using the stomach 36, I'm sure it was a hot moxa because there's lots of blisters, but that give them a longevity. They live, you know, close to 100, 120, you know. That is like, if the stem cell is like getting activated constantly, that makes sense, you know. And then the stomach 36, it gives you a bit of longer telomere, isn't it?
Telomeres,
yeah. So that's my head goes. That's how I think, you know.
But you've raised an interesting issue about the blisters, because back in the day in China, if you didn't create blister, you forget it. There's no effect. You know, that's Ming. I'm quoting Lorraine Wilcox's work on that one. You know, Ming Dynasty stuff. You've got to create blisters, and obviously that is, you know, the dynamic of that is very different to Japanese, isn't it?
Yeah.
But I think Hara Sensei, he was saying he wasn't into blistering. I'm sure people did you know, and his maximum temperature was meant to be 70, 80 degrees on the skin surface, I think. So,
that,
you know, but that means underneath it's going to be 38, 40, 45. In the epidermis, it's only going to be up to that temperature.
yeah. So it's interesting, isn't it? I love this, you know, I always think about these things.
Now, there's one other aspect. Sorry, Bob, I know you're dying to get in here, but I've got one thing I just want to throw in before I forget it, and that's the infrared aspects, the spectrum of the infrared. So if you want to say something else, then please jump in. But I just like to come back to that, because then there's another potential mechanism, a whole extra ball game going on. So
no. Okay, so staying with this transdermal movement of plant constituents, a famous member of the North American herbal community, a PhD, I think in botany, used to teach at UCLA, brilliant guy. His name's Ryan Drum, because I've been interested in topical herbal medicine for a very long time, right? The famous French herbalist of the World War II generation, Maurice Messiguet, he only used, he gave teas, but you put your hands in the tea and your feet in the tea. He never gave internal. It became a millionaire herbalist. You know, his company's still going, he's long dead. So there's obviously something different about topical herbal medicine, because if you take something internally, your digestive system is going to pull it molecular limb from molecular limb. It gets into much simpler compounds. And what Ryan Drum said is, he said, medium and lower molecular weight plant constituents can move transdermally and go straight into the lymph, go straight into the blood. And so you get novel chemicals in topical herbal medicine in circulation that never would have gotten through the gut. So in that way, topical herbal medicine, and here at OCOM, we were lucky to have Hong Jin, a real expert in that, but also Andy Ellis here in the US, a real expert. And he used to come regularly to Portland to teach that it's different. And so the idea of Moxa without any barrier being explained as transdermal movement, at least in part, right? We've got the heat, but we got partially this story of transdermal movement, possibly, of chemicals. But I still keep coming back to, like, we ought to have our senior herbalists working on a variety of barriers so that when this modest heat of shunko, of moxa is done, right, the half rice, and that we have the chemicals moving through that we want to, that an herbalist would want to get into circulation. I think it's a field to be explored myself.
Yuki, you'll probably remember this better than me, but I think Koshiishi was talked about the origins of shunko. It was originally for ulcers. Was it?
Yeah,
ulcer
for the
cream?
skin disease. Yeah.
And it's relatively recent. I mean, by comparison to the rest of Akimoxa, it's kind of like 100 years old or something like that.
Yeah,
is that right?
they didn't use it before.
Yeah.
So
we're already in the
right.
modern era sort of thing. It's not, it doesn't go back hundreds of years, this.
No. And you know, like Dr. Denda, you know, he studies in Japan. You know, he's not acupuncturist, he's a medical doctor, but he studies about skin, and he said, you know, skin's intelligent, you know, skin can think, and then also skin is the extension of our brain, you know. And then Dr. Mukaino always talk about that. The skin is the extension of our brain, and then they don't need a strong stimulation, you know, they just need to be taught, you know, very gently touched, you know, that's something that your body doesn't reject, you know. So in the M test, we don't use the needles, we just use the very fingers and, you know, the patch, or, you know, I just use Moxa on the M-test points. And then it's just giving your body to think, it's almost like, like, it's like a, I don't know, math, isn't it? You give a, numbers and then your brain calculate, and next day they said, okay, I'm going to heal, it just takes, there's like a little time lag, but it have to happen through their body, not by forcing from practitioner to change something, but we just kind of guide them. So we just have to put in the right place some stimulation, and then their body have to process it. I think that is for me, at least that treatment lasts longer than, any other. So when they woke up from the treatment table, they often said, I noticed that the more elderly patients, they said they don't feel anything changed, and then the next day they call me, the pain's gone. So I want to make another appointment, It's like, I have to just wait, even I want to treat more. I feel like, oh my God, I didn't do that good, good treatment. But next day, I always tell them, or I even call them how they are doing. And then they said, pain's better, it's less pain, or, like, especially shoulder thing, it's, I can't maybe change them right away, but next day they said, oh, it's working, I just have to be patient. I think that's what's happening when you set a pulse, it's not coming together. It's just their bodies have to process on their own, and we can't, disturb that,
Right. There could be this temporal bias on my part towards immediacy, right? And that comes
Yes, I
from
have that too. Yeah.
meridian therapy training. If you do something and it's helpful, you should be able to tell right away in the pulse. I remember mentioning that to one of Leon Hammer's closest students, and he said it might show up when the seasons change if you've done something good. He said, don't be so biased temporally to the now. We need to be aware of our biases. So, I still think about that, because obviously if I'm doing something, I want some confirmation that it's helpful. You see this in other styles like the Worsley style as well, for instance. So a tricky question, right? I still have to experiment more by doing a better job of like the Koshiishi root treatment and seeing if that changes things, which as I said, just in the last month or so, investigating that with some of my patients.
Yeah.
I just want to add one more thing into this conversation, which is something that I can't remember exactly how the conversation, that this particular exchange occurred, but it was when Koshiishi Sensei came and we're down in Devon, and I was having a conversation with her on the side through interpreting. Well, I don't know. I think it must have been through Yuki, but I don't know. It might have been somebody else. But whatever. I remember her saying basically, it's all, this meridian therapy is all very good, but if the patient's pulse gets better, but they don't get better, then what does that tell us about meridian therapy? And I felt put in my place, at the time. I'm thinking, here's me, and I've been programmed to think pulse, 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 pulse. And she's basically directly challenged it. But if the patient doesn't get better, and this was being said to me by somebody who plainly picks up patients who are very, very difficult to treat, and she gets good results with them,
Because she studied, the Keirak Chirio, the meridian therapy really intensively, she even had so many treatments on herself, as well. So yes, so she knows something, and I really respect that, that what she shared with us, and yeah, I think it's just that, yeah, if the Dr. Mukaino and the Koshiishi sensei said the same thing, if the patient doesn't understand if they are better, what is it, and Yuri used to say that, yeah, a lot of acupuncturists trick their patient, say you're better because, because I did the treatment, or even they don't feel any difference, and then
The pulse is balanced, right?
Yeah.
pulse is
Yeah.
balance.
Yeah.
I didn't want to say,
Yeah.
yeah, it's the patient. If the patient doesn't understand, it should be simple. It should be, Dr. Mukan always said, like it should be a very clear communication between the patient and practitioner. We are like doing this together, and then not only, one way, kind of a interaction, So I take it really to my heart, about that. And then so I always ask so much questions. What should I do? And a lot of my patients give me a feedback. Yeah, 2 times ago you did this treatment. That was better. I want that, which is I love it. It's, and as they said, yeah, the M test, yeah, okay. So it was the LI11 worked, and then so it's the so at least both sides should understand what we are doing, and that is possible through Koshi sensei and the Mukaino sensei's sort of like ideas, which I just stick with it,
Yeah, the part of me that has, I did the Toyohari basic training twice, so that's 18 weekends, and then they have the Toyohari gathering, international gathering here in Portland, so had access to really advanced Japanese senior teachers, and then training in the Shudo style, maybe I think 12 days with Stephen Brown, and then all the other styles I've learned. There's a part of me that just will not let go of the idea that the root treatment's important. So I'm very happy that Koshiishi, she has that idea and she's doing it on the spine. I want to come back to that in a minute. But it's still going to be my project to try to be true to to use other skills, Teishin, Sotai, Yin Sotai, try to somehow have a pulse that as I call myself a former meridian therapist, but it's still part of my identity, that I could present this pulse to one of my teachers and I wouldn't be embarrassed, right? That I've done a treatment that's got symptom relief because maybe the Koshiishi work and other things. And at the end, the person feels in some way on a deeper level transformed. I was never interested in being an auto mechanic for human bodies, right? Just fixed shoulders and knees all day long. I think our culture is in trouble in so many other ways, spiritual ways, that to kind of bring people to a deeper sense of themselves, that's what brought me to Chinese medicine in the first place, not just fixing knees and shoulders and hips and so on. But I don't want to ignore that. That's the suffering that someone brings. And so I want to help with that, but I want to do more. That's kind of my position. Now, I think Moxa is a big part of that. If you have like a sharp pulse quality or a little bit vibratory, and you just do a little Moxa, say on Ren 12 or Sanjiao 4, stomach 36, and you check, it's an amazing change, and you see in the person's color in their face and so on. So I think Moxa has, we haven't explored it in this conversation, but real important role in treating Shen spirit disorders, right? It's and it is fire, which is kind of, if we're going to pick one of the 5 phases for Shen, it's fire for certain.
Yeah.
I'd like to jump in just because you mentioned triple burner 4 there, and I don't think this research was ever properly published, so I don't know exactly how rigorous it was. But there's a guy in Switzerland. He was a Thai Harry guy at the time, and he did this research in a lab in Switzerland where they were able to measure biophoton release from the body.
Fridge pop.
And yeah, that's it. Yeah. And they used a Chinetsku, so very mild warming, large cone Moxa on triple burner 4. And what the camera recorded, at least this was a first-hand account from the person who did it. As I say, it wasn't published, but what he said was that the whole body just suddenly went and just released photons. Now, I have no idea what significance that is, but it strikes me that's got to be significant. You know, if that's happening, not, you know, before and after this isn't happening, then that whatever it signifies, it must signify something important. And that again is very, very mild heat with a Thai Harry style Chinetsku Moxa treatment, and that was on TB4. I don't know why they picked TB4. Ren 12 maybe do exactly the same thing. I don't know. But to my knowledge, it's never been replicated, so I don't know.
Yeah, he's dead now, Fritz Pop. I've seen a video. I can't say who has it because I don't want to name her here because people will bug her, and I don't think she's comfortable sharing it. But when the first cone was done, the entire meridian lit up.
Okay.
The second cone was done, and it became a local effect.
Oh, right. Okay.
Isn't that fascinating?
Yeah.
Oh, that's interesting.
So you want to check, you know, it's just a whole world to explore here, isn't there?
Yeah.
I mean, yeah, go ahead, Yuki, you're going to jump in.
Oh, yeah. You know, I was, you know, just thinking about the root and branch, you know, the treatment. Like, so my very childish brain, you know, when somebody said root treatment it's a spine's root, you know, branches like maybe hands and feet, you know, and then, you know, like in Chinese character or in Japanese, back is it writes nose and the moon, you know, and I always wonder why so there's a moon and there's a nose, and that means the whole back, you know. And then, you know how you say, like, when you get lost, look for the moon and there's a star, the nose star, you know. And then I always wonder, you know, that is maybe the where the, you know, when you are lost, I always treat the back because I get lost quite often. I don't know where to treat. So I always think like, okay, set is you know, the back, so the nose and moon, and then the root treatment is not that like a theoretical the root treatment like a liver or, you know, the organs, but it's like for me it's like spine, you know, because that's where like, you know, all the nerves and, you know, spinal fluid, you know, that fluid, it goes to the brain and it's just circulating, isn't it? So, you know, like Moxa, you know, the mugwort is the one that increases the circulation. So if you can clean up so, you know, I put it, you know, Koshi sensei does it, you know, the way in a little dip in the spine, that's where the big cone goes. So imagine that, you know, I sometimes do from the back of the neck all the way to sacrum, like whole point. I know this is too much, the treatment, but sometimes I actually intentionally do it because I want to move this kind of a stagnated, the fluid in the spine. It's the you know, it's like where the meninges, isn't it? You know, meningitis, you know, whether you put the needles to check the spinal fluid. I love to move that thing. And that's my root treatment. You know, then I flip the body and I treat the belly button, because that's where I feel like there's something in the belly button. The reason that I'm doing this is my daughter, Nana, she always asks me to moxa inside her belly button since she was little. And I asked her, why you like it? She said, the whole inside of her body gets warm through the belly button, So I put the cream, my version of Shiunko cream inside her belly button, and I light it. And then usually she falls asleep, It's something to do like a prenatal. It's something to do with the kids love to be touched, the belly buttons, But so that's my sort of like root treatment, when the Bob-san mentioned, the root treatment.
Well, go ahead, jump in, Merlin.
Well, no, there's a couple of things. The first thing is just when you were saying about the spine, there's that famous Moxa treatment where you cake a load of garlic down the spine and then you pile a load of Moxa on the top of it, and God knows what it does to the patient. So I just wanted to just throw that one in. But the thing that I actually really wanted to say was the actual ideogram for Moxa itself, Zhenzhou, or whatever it is, how you pronounce it in Chinese, or the Q, is the fire underneath this, which nobody has ever successfully given me a decent explanation of what that actually signifies. But one of the things I've seen it described as is a curved back. It's like a bent back. So it very, very much is coherent with what you're saying. Here we've got and this is a very old character in the Chinese. It was used before they put the fire underneath it, as I understand it, and it was used on the oracle divination. They used the same character, so they were burning something and breaking up these oracle bones. The scapula and things for the oracle, for the divinations, but they're, it's something old, or it's a bent back or something. But I've never heard anything where anybody coherently, confidently says this is what this old character means, where it came from. So, but the fact that that one of the explanations is the back, it's the spine, it's that shape in the character. It's the, and maybe it's got the nose at the top, just like you said.
I'll ask Heiner Fruhoff, who's he's fascinated with all the oracle bone characters and how they transitioned to more modern characters and so on. I'll be with him this coming weekend, so I'll ask him. I'm curious to follow up on that one. So we were just in a 10-day retreat on his land. There's 16 students from around the world. One of the things we were diving into is concept of Zhong Center. And he goes into this brilliantly in his long forward to the book from Yang Zhenhai and Liu Lihong on the Yellow Emperor's transmission of acupuncture. Great book. Liu Lihong is trying to rebirth this bodywork technique in China because remember in the Neijing it says, if you're in the north, Moxa is the therapy for you. If you're in the south, I think herbs. But in the center, the therapy is Daoyin Anqiao, right? And so you have this idea of guiding energy along the center. And of course, Heiner says, of course, center means a lot of things, but for his colleague Liu Lihong, what it means, he's doing self-treatment on his Renmai, but on his patients also the Dumai. Now I'm in contact with the two German scholars who are kind of introducing into Europe this Daoyin Anqiao. They do it on almost all the meridians, not just the center line, but the center line has a favored place for them. So I've been introducing that. You know, I know how Liu Lihong is doing it, and it's very powerful therapy. That's work with the center line. In the Edo period, you had Ishisaka Sotetsu, right? He saw in the modern European textbook the importance of the central nervous system, developed his own style with a lot of in and out needling on the spine, Poitou line, inner bladder, outer bladder, and so on. I studied that twice with the only person here in the US teaching it, Kubota Sensei in Asheville, North Carolina. It's a heck of a lot of needling, but it's certainly has a focus on the spine. In the end, they turn you over and do a little bit of needling on the renmai, that's it. Otherwise, you're face down and getting a lot of in and out needling. And studying with Dr. Baer, he's going to pick something near Do 14, something near Do 4, and maybe one other level. And he's going to, and he might do it with Moxa, but he's for sure going to use his Taishin because he considers the spine very important as well. And you know, if I had to train people in the developing world, I've been thinking for years, how can we teach them to access the spine in some way that's going to be helpful? You know, Merlin, you and I have talked about the PNST, right? Prickling with this tool, kind of a heavy-handed Taishin technique. That's one possibility. I think it might be that Moxa is the better possibility in terms of it's going to be comfortable. You just have to kind of help people develop the skill to find the wise points to treat on a given body. Because I've done that treatment with garlic and the whole spine treated. Took 2 or 3 hours. We burned a whole 100 grams of wakakusa moxa. You know, we made a slur. We couldn't get the Chinese herb you use, which is very aromatic. So we had an abundant supply of rosemary. So I made a slurry of garlic and rosemary, laid it on the whole spine, and just kept burning big cones of wakakusa moxa. Takes a while for them to feel the heat, and so I wouldn't want to do that day in and day out with patient after patient, but I wanted to try it at least once. It was someone with a lot of parasites that I did it. He slept like a baby that night, by the way.
Yeah, yeah.
So in the doctoral program, a survey was shared with us by the head of the program. I don't know where he got it. So this presumably would have been done in the late 90s, early 2000s. That said only 6% of North American herbalists use Moxa, or acupuncturists use Moxa at all. And you can bet most of them are using pole, right? Smokeless pole, smoky pole, or stick-ons. How do we change that? I think if we can change that in the practice, then there's going to be a lot of support for Moxa Africa.
Yeah, yeah.
Because people don't appreciate.
Yeah.
Go ahead, Yuki.
No, because I wanted to make the Moxa more accessible to practitioners. And then, so, you know, I told Martin, you know, maybe beginning of this year, but, you know, I was, you know, in the process of making this, like, and it's like, you know, charity in the US, you know, and then it's called Hinoko, you know, which means like, it means like a fire dust or children of fires, you know. I haven't done anything yet. I just made this organization, but haven't done anything. But my intention was to spread the Moxa, you know, but the fire medicine, it's basically, you know, not the needling, but I want people to experience this, you know, the Moxa is so powerful, and then it could be really gentle, you know, it could be, you can use it like needles, but then I think in the end, either you are good with metal or fire. It comes down to like, which one your, like 5 elements, like are you a, sword master or fire master? I think it comes down to kind of, which one you work with. And I am completely fire, I love using fire. I love using, moxa as a medicine. And then, but I, there is not many acupuncturists in Japan as well. I mean, England, I don't know, like the many people use moxa. They use the cigar moxa, but I think it's just as education, it's not available, And then what Moxafrica did is incredible. Is like we kind of like show them, how we can do moxa and actually treat something like tuberculosis or HIV, which is like, it's amazing that Dr. Hara was doing this 100 years ago, and it still works. And there's like lots of improvement to be done, but, what, Moxafrica did is like, it sparked a fire in Japan, a lot of a practitioner didn't do moxibustion, but when when me and Mani was touring Japan to talk about, the moxa, a lot of people were like really kind of fired up. They're really excited, and then I wanted to do that in North America, but my life got quite crazy last few years. So I haven't done anything with this hinoko, that I created the, the intention of like making more people to use the fire as a medicine, so it's really frustrating, in England, local here as well, not many people use moxibustion, and it's such a cold, damp country. We should be using more,
So Junji had the idea that I think he's still doing, maybe every other week or so, that he has a class for the public.
Yeah.
And it's free. You come, he'll teach you how to do moxa on yourself. And I had one chronic Lyme patient who was in a wheelchair when she came. She did a lot of other things to help her. By that, I mean kind of mental, emotional things, but she's very sick, couldn't graduate high school and so on. And had very little money for Chinese herbs. The college agreed to see her for $5 a treatment. So my students and I were helping her. She really took to the moxa and started doing moxa on herself every day. And she became, unbeknownst to me until later, kind of a lay moxabustionist in her neighborhood, helping other people. And you think, well, in Japan, monks doing this, grandmothers doing this. I think there could be a role, and you see these poorly educated kind of high school dropout Catholic women, and Ciudad Juarez doing it, a beautiful job of it. That we want to reach out to the professionals and have them do more of it, but there's part of our effort could well be to reach out to, the herbalism. We don't have medical herbalism here like in England, right? The people doing lay herbal practice in North America, they have no legal license to do anything with a patient. But I think they're a crowd that would be quite open to, and midwives for years in the US have been doing moxa, simple things on the sacrum.
Yeah.
There might be a place for reaching out to the general public and declaring this a folk medicine, where it's both a professional medicine where there's a lot to learn from the literature, but on a simple level could be a folk medicine. Do you have resistance to that, or you're open to it?
No, I think it resonates perfectly, doesn't it? It brought to mind, I think Tracy Thorne took a group to Tanzania.
Oh.
I think it was Tanzania. It was somebody did, and they taught these.
I don't know if she went.
She went
Right.
to
Well,
she went to Texas and Mexico.
okay.
Yeah.
Somebody went to Tanzania.
Tanzania,
they-
the students that are at the NUNM.
That's right. That's it.
I taught
And they
yeah.
and they taught these. There was some fantastic photo of the seaweed women. Do you
Yeah.
remember? And there were
Yes.
these bunch of women lined up, and they were dressed up in all their finery and things, but they were doing Moxa on stomach 36. That's exactly the sort of thing you know. It's because it is. Well, Dr. Hara, I'm not going to be able to quote him direct, but he said it's a proletarian medicine. And this is in the 1930s when it was politically more acceptable to use words like proletarian, and it went down better. But it is a proletarian medicine, you know. It's people's medicine. That's what you'd call it, and I think he's right. Yeah, and we've always kind of like skirted around and hoped to touch into indigenous communities to try and you know, just to cross resonate. But the interesting for us was we were acting as midwives. We've got a traditional treatment from Japan, and we're trying to introduce you to a totally different culture in East Africa. That was our first steps. And we were acting as midwives. It was for me, it was an anthropological experiment. And I remember writing to a couple of people at Oxford University, hoping that they'd get interested in this, and they'd want to be part of it, and then maybe want to film it, and they'd want to write up on it and things, because, and you know, this is quite an interesting idea, really. You're going at ground level, from a ground level traditional therapy into a ground level treatment in a totally different culture. And to be honest, I can say firsthand, there was no problem introducing it. There was no problem it being received. The problem was keeping the thing going, and that is a dynamic which is still confounding us, definitely. And we haven't mentioned it yet, but this work we're doing with looking at long COVID, using Moxa for long COVID, we're hitting exactly the same problems. It's kind of like some people get it and some people go, wow, I love this, I think Moxa's fantastic, and the majority don't go through either the full enrollment process, or if they do, they don't complete this so-called 100-day period where we're asking people to Moxa themselves with the best of motivations. They want to get better from long COVID, but it's not as easy a ticket as we imagined it, either because it isn't an easy ticket or because we're not doing it right. We need you know, new ideas about how to introduce it and how to create, how to light the fire, really, in that respect. I think it's been a big challenge for us. You know, everywhere we go, we start off, we're not into project work anyway, because the money we raise is for investigative purposes, but basically we want to leave behind some sort of project work behind us, which we don't want to support because it would be too complicated for us. But these projects don't self-sustain once we've kind of like pulled out, in a sense. We've moved on. So it's not easy, I don't think, this, but it only needs the right piece of momentum, the right, for the sake of, well, I hate to say it, the right personality, you know, celebrity endorsement, or, you know, and it makes a difference. That you've got to create some sort of dynamic to make it really work.
Yeah.
I don't know. This has been an ongoing chat. I've just got to plug in.
Yeah, you know, like remember in Japan at the Earth Day in Yoyogi Park.
Yeah.
That was amazing. You know,
astonishing.
Yeah, it was all the Japanese Moxafrica supporters. I think we had about two or 3 days, maybe 40 acupuncturists came all over from Japan, and they Moxa just people who's coming to the Earth Day event. 2,000 people in the 2 days. We Moxa their stomach 36, and we introduced Moxafrica's work, you know, and most of them was like first time they did Moxa, you know, in Japan. And then I know a lot of people started doing the Moxibustion after that, you know. It's like, you know, I had this like quite you know, the dream, the plan to do like, you know, the park in England or something in London, you know, like
Yeah,
how
you
people
mentioned
always park, you know, always
Hyde Park in London. You wanted to do,
yeah,
didn't you?
yeah, I always wanted to do that, you know, like I just bring like so many acupuncturists who can do Moxa and just let them do the Moxa, you know, on stomach 36, you know, it's just completely free, you know, everybody just can try it. It's not scary, but your feet, when you walk, it gets maybe you can walk a bit more, you know, when you are tired, when you come and sit down on a park bench. That was my idea, wasn't it, Marlene? We thought about it, doing it.
Yeah,
Yeah.
I haven't got the courage.
Yeah.
Well, you mentioned money. I want to jump in and say the people listening to this, I hope that they go to the Moxafrica website, right? The Moxa A, the final A is shared with the A of Africa in the front. So moxafrica.org and donate. We're going to push this on Facebook and through Blue Poppy newsletter, and you can push it through your channels as well. And I also want to mention that the book you did, Merlin, is just by far the most amazing Moxa book. I think Lorraine's books also deserve mention, but for someone doing Japanese style practice of whatever sort, meridian therapy or shakuju, whatever, your book is just such an important, gives the background information, you know, the treatment information. It's just an invaluable clinical aid for anyone doing Moxa. Everyone has to own that book.
Yes.
So I'm sure a lot of work went into that. And so thank you for persevering and pushing that out. You know, when Funamiso Sensei was here the first time, he brought, you know, these little bamboo rings, right?
Yeah.
I have a friend with a bamboo nursery not far from here. So I went there and cut it. I just discovered them in my tool shed. I've got probably 100 of them. And he put a very porous cloth. He glued it on the bottom. So I think you would still have some movement possibly of plant constituents, but of course he's filling this with salt. Yeah, you talked about the, you know, the navel, the CV8 Moxa. What do you think of this? This might allow people in other parts of the world, say, you know, here in Central Oregon, this whole landscape's full of Artemisia tridentata, which the native tribes did harvest and they did burn it, but more in ceremony, right? As a part of a cleansing of the ceremonial space, as I understand it. And I've had North American herbalists, lay practitioners ask me, have I ever experienced with you know, doing dried Artemisia tridentata instead of the Asian mugwort, what would happen? All interesting experiments as far as I'm concerned, since there was a tradition of burning it, right? What do you think about the potential of this to get more people excited, because they don't have to really learn any technique? You know, as it gets warm on the navel, you move it to 10 or 12.
Yeah.
Is this worth pursuing with trying to reach out?
Maybe it is. Funny enough, I was using something slightly more primitive. I was using actually a toilet roll. You know, the cardboard and a toilet roll, same thing. A piece of tissue underneath, fill it with salt, and it works just as well. So you can get pretty simple, stupid with it. Yeah. I'm interested. Sorry, Yuki. Sorry.
No, go ahead.
No, because I'm going to blast off on a bit of a tangent. So jump in first.
No, I sort of that little ring thing is maybe good for the belly button. Yeah.
yeah,
It's
definitely.
easy for
And
the
the
people
whole of the
to do
lower
it.
jaw as well, I think. Yeah, yeah.
Yeah.
And of course, the salty flavor is the flavor of the kidney. And we thinking here of this, as you mentioned, this prenatal connection we have at CV8. And so salt, particularly there, seemed the wise way to go, at least if you're following traditional ideas.
There are so many things coming into my mind. One of the things that I came across when I was researching the book actually was the fact that possibly it's not, I don't think it's proven, but possibly the average body temperature of the modern human being is a little bit lower than the average body temperature, say 60, 70 years ago.
Yeah.
So anything that potentially, and I think we haven't mentioned him, the Toru Abo, the immunologist, Japanese immunologist who was very interested in temperature gradients and what happens to the immune system. The immune system becomes dysfunctional as the body cools. It's part of aging, the aging process, generally speaking. So anything that potentially could actually change the core body temperature in a mild way potentially has huge therapeutic possibilities, I'd have thought. But I just want to jump back because I just want to come back to the Moang Dui text, which you mentioned, Bob, because from my reading, and it could be wrong, but I've publicly spouted this several times and nobody's jumped on me yet and said, you don't know what you're talking about. Because I don't read Chinese, so I can't say for sure what I'm talking about is true. But what I read in terms of the translations is you have these Moang Dui texts which describe these 11 channels. And they don't, as you say, they don't have any points, but they have a load of prescribed symptoms or ascribed symptoms. And then if you look at Ling Shu 10, and it's copy and paste or it's plagiarism, it's the structure of the chapter is, it's like, it's just too similar not to have been basically stolen. And yet there are minimal references to Moxa in the Suan. There's a couple, I'm going to say a couple, there's a couple in the Ling Shu that are important references, including that one about Suan 60, I think it was it 12, where it says Moxa comes from the north, whatever that means. But, and in the Nanjing, there are none, absolutely not a single reference to Moxa in the whole of the Nanjing. And I think that tells us a real story, is that as the technology for making needles developed, and as these ideas for using acupuncture therapeutically for using these, for regulating these channels, these lines on the body, then basically there was money to be made. I'm going to be cynical about this. There was serious money to be made by the practitioners of it. And they basically just parked the Moxa on the side. And I think Acumoxa still suffers from that today. It still suffers from it. It's kind of the poor relative. I think that was kind of like one of the things that for me revealed itself in the book, and I tried to kind of like make it a theme really, that Moxa is massively undervalued and is still being basically and part of it I think is that the Moxa guy, the acupuncture guy, the needle guys, and I'm a needle guy, we can make it look so smart and clever and you know, and frankly we can charge a little bit more in the process. You know, medicine is full of overcharging for services, which is very, very evident today. It's probably more so than it ever has been. But I think these guys who developed the medicine back in the Han Dynasty were quite probably guilty of a little bit of fraud, really, because they didn't acknowledge their sources at all. And their sources were the Moxa people.
So it's intentionally deleted, isn't it?
Yeah,
you know,
I
it's
think
to gain the, you know, the needle side.
Yeah,
I want
and
to say
to gain respect, to gain reputation, and for fun. Because the people who you imagine how expensive an acupuncture needle would have been in the 1st century AD, whatever you call it now. It's kind of, it would have been incredibly difficult to make a fine needle. So that thing would have been precious. Moxa guys, you go out in the field in the middle of summer, and you've got something to burn. So I think there's a big issue. So that's one theme I want to. But the other theme is that this idea of using local local mugwort. And I think there's much, there must be mileage to be looking at, because I strongly suspect that the Moxa originated from the north, if you want. It was from the other side of the wall. So it was from foreign territory, on as far as the Chinese in the 1st century. That was the north, and basically it was shamanic medicine. It was shamanic medicine that was about clearing space or whatever. It's exactly the same idea that originally came from a tinder material, because it was highly valued because it lit fires. So I think that, you know, if it's used for smudging in North America, in indigenous then it smolders. And if it has that, maybe it has those resonances that the Asian mugwort has.
Well, I want to say something about the power there, you know, like needle, acupuncture, and moxa. You know, it's like the power balance is like, it's like that. It's, you know, needles maybe 70% and 30% is maybe moxa. And then that is sort of like, you know, it's like yin and yang, you know, and also who's more on the stage, you know, because I met so many female practitioners who does fantastic, amazing moxa treatment, you know, but they don't come out. They don't come out because they just know they don't want to compete with male practitioners, you know. And then I will say this because I know a lot of my female colleagues feeling same way. Is like, you know, like when you go to conference, it's pretty much all male dominant profession we are. But it's actually, there's a lot of fantastic, amazing, you know, badass acupuncturists for female. The Moxa is, so many of them are just quietly, very quietly, every day treating patient, you know. And then that's why I wanted to make this organization, because I wanted to feature female moxibustionist, you know. That's because there's so many I know in Japan, you know, like so many people do amazing moxa, but they don't get the spotlight, you know. And then this feels like, I don't know, needle and moxa, you know, it's kind of like, it's very similar, you know, male goes to the, you know, male practitioners on the stage, you know, but there's actually a lot, you know, who does moxibustion, you know, but very quietly. I just want to mention that because every time I go to acupuncture conference, I run into similar problem. I just want to see all female speakers at the one conference, only females, you know, and then it will be like completely different, you know, conference. And also, you know, like the mugwort is always kind of associated with the female, isn't it? Gynecology, queen of herb, you know, it's always like not the king, it's the queen, you know. It's, there's like something about the relationship there. Just had to mention that before I forget.
And my knowledge of Greek mythology is a bit ropey, but Artemis
Yeah,
is female, isn't it? So even the plant itself in Western lore is similar. But and Bob, you mentioned when we were having the email exchange, you mentioned what Yuli had observed about Koshiishi sensei.
Remind me again.
Well, you said that what Yuli had said to you is that if Koshiishi sensei wasn't female,
yeah, that if
it'd be super famous in Japan.
If she were a man, she would be acknowledged as the best practitioner in Japan. When we were together in Israel, he was telling me stories of watching her work and receiving treatment, where he said he felt like a different human being for days after receiving her treatment. And we've mentioned Tracy Thorne before. She also, I think, probably with you, Yuki, went observed for
in Japan.
At Koshiishi's clinic.
So
It's
Yeah.
still a man's world there in Japan. And here, our students, all the acupuncture training programs here, they're probably at least 70% female students. And then you go to the conference and it's 80% male presenters. It's just such a curiosity, something not right about it.
We are very busy, sometimes raising the family, and I feel for lots of female practitioners, but we just have to give the equal opportunity, isn't it? And then that'll be great.
Yeah, we have our organization here in the UK, the British Acupuncture Council. I'm going to write to them next week, and because they have an annual conference. It's a nice conference, but I'm going to write to them and say, look, I think it'd be a really good idea if the conference for 2023 has only female speakers. Let's just try it 1 year and see what happens.
Do that. Yeah.
And see what they say.
Yeah. It's when I was in Japan, like I was invited to speak at this kind of a big meeting, like the association, Japanese Acupuncture Association, So I went there and then everybody's sitting on the table, all male, 100% male. They're the top association CEO or whatever. And then there's like few female in the room. They were giving everybody teas, and I was like, oh, wow, you don't have any female, like, how do you go, member, in the association. And they said, yeah, we do. Here, they're serving the teas.
Right.
And I was so crossed. I was really, really unhappy about that, So I spoke about it maybe about 10 minutes. They didn't even register, what I'm saying. I feel like defeated there, and I said, you can't use the female, they should be sitting with you guys right now, listening, not the serving teas, but it's Japan's like us though. Yeah. But I just that Marty, you mentioned the TRP, so Koshi Sensei is doing the quite intensive study with Dr. Tominaga. So Dr. Tominaga is a TOMINAGA in Japan, that he specializes in a TRP receptor, and then so they've been, really talking a lot. And then Koshi Sensei's daughter, Naomi Sensei, she might be do the research with him, which is fantastic.
Yeah, brilliant.
Yeah.
So progress is being. Merlin, you wanted to go into infrared.
Yeah, well, because then we've got a whole another possible mechanism going on. And actually, this crosses over into stuff which actually I'm really interested in at the moment, which is the effect, because it's some quite interesting fairly recent research on the near infrared that's been done from American researchers, and the effect it has on the intracellular activity and creation of melatonin within the cells. But be that as it may, there was some research done in Shanghai. I think it was the late 80s, I think, and they were looking at what you call the spectral profile. I can find it and kind of like put the book up and try and explain it a little bit better. But the spectral profile of mugwort, or of Moxa, when it's smoldered. And what was really interesting, let me see whether I can find it. It was a very expensive piece of kit, which I think you need to have NASA sort of budgets for and things. But basically, they were looking at actually the far infrared, not the near infrared range of solar, what is obviously also in solar radiation, but and they were looking at this profile. So if I lift this up to screen, I don't know if it can be seen, but there you've got the dark line is the spectral profile of mugwort in terms of its proportions of each wavelength. I don't know if you can see the wavelengths at the bottom.
Yeah.
They go, yeah. So they go from very small to slightly bigger, and they peak. The peak of the at the highest point is about 7.5 microns. And what they discovered, they didn't use actually just Moxa, which is actually a bit of a disappointment, and it may mean that they didn't get very good results with it. But they used Moxa on three substances: on ginger, on garlic, and on aconite.
Oh, okay, aconite.
And what they found was the profile, burning Moxa on all three of them was all three were almost identical. And they also did a control, which was burning it on let me make sure I've got this right, cucumber and on carrot. Okay, so now I'm going to bring another profile in. Hope you can see it. So I've probably been moving it too much. Let me try. So the dark lines at the top, they're almost all identical, is the mugwort on the aconite on the...
Go back a little bit.
Sorry, yeah. Is that any good? Or shall I go forward? Shall I try forward?
No, I see it. I see it.
Yeah. So the dark lines that are almost the same at the top are on the three substances, the conventional substances, and the ones with all the little dots below them, that's the carrot and the cucumber. In other words, you've got completely different profiles. Okay. Now, just bear in mind what that shape was like, because then this is the spooky bit. I hope I've got it. Oh my God. Yes, this one here. Yeah. So here, this one, the dark line is the average spectral profile of the three substances. So it's like they've unified it. Right. And the one that just strays from it, just here and there, you can just see a little light line near the top, and then a little bit further down. That is the spectral profile of the near infrared that emits from Hegu, from large intestine 4.
Oh my God.
And it's almost identical in terms. Obviously, the actual quantifiable amount of heat is of a different scale, but the actual profile, the proportion of the near infrared is almost identical, which suggests that there's something pretty like, it's like, for me, if there's a lock and key for getting this energy into the body, if it can come out in that profile, then it looks like it can go in at that profile as well. So the infrared energy is able to absorb. And I think their conclusion was, and I don't know whether you could draw it or not, it was reasonable, was that it would resonate, that there would be cellular sort of kind of resonation beneath the skin surface as a result. But I've never seen that research. Actually, let me just find it. I can give a date to it. I hope. Of course, I can't now.
You said 1980.
I think it was the 1980s, and I really should have it. You know, I can't find it. Isn't that annoying? While we're talking on something else, I'll have another look at that, because I'm sure I can find it. But as my memory says, I've just written Shanghai team. That's not very helpful. Research from Shanghai. No, I can't find it off. But I'll try and look at that while we're talking about something else, and hopefully come back. So there's a whole extra aspect or mechanism there that could be happening as well. Now that's going to happen whether or not the patient feels it. Doesn't matter. It's the infrared the infrared is infrared. You know, as long as it's above absolute zero, it's infrared. It's still there. You may not even feel it as warmth. So that's
the Mrs. Koshiishi.
Yeah. And also, I think possibly explains the Itaya technique with these large Genetscu cones, where you actually monitor the smoldering of the cone from the pulse, and then when you feel the pulse change, you lift the cone off. The patient's not felt it.
Right.
it may explain that. You know, it's just another aspect to throw into the mix.
Yeah. It's so interesting, isn't it?
Yeah, yeah,
Skiing is amazing.
yeah. And this but the fascinating thing about this other research that's emerged recently about near infrared is that it penetrates right into the body. The near infrared can penetrate, they reckon 8 centimeters into the body.
Yeah.
So if you're absorbing it, then it can come through cloth. So if you're lying out on a warm day, your whole cellular body, and this wouldn't happen if you're particularly large, but if you're not large, then basically if you lie on your back and you lie on your front, your whole body, the whole interior of your body is being bathed in near infrared energy, which has this effect on the cells.
Oh,
Just came home. Yes. That I come say hello.
Hiya, how you doing?
Good, thank you.
Good.
Just came home from the football. Yes.
Oh wow.
Go shower. Have a bath.
Can
Yeah.
I have a piece? No, yes, that's the last one.
Yes. Yes. She wanted to eat seaweed. Yeah. That's yeah.
if you can send me the link or the information when you get it, I'd love to
I've got to
follow,
find it. I've got to find it.
read all of that. It doesn't have to happen now.
No, I've got to find it.
That is, I never knew that, Merlin. That's so interesting.
You didn't read the book properly.
Oh my gosh, yes. But you said near infrared and the far
That's
infrared.
near, yeah. And
Yeah.
So
Yeah.
that profile matching the profile of Li4 is
it's spooky. It really is spooky, that I think.
it's like Moxa is doing Li4 to the whole body or
Yeah,
something.
yeah.
Wow.
Well, I'm going to be thinking about that the rest of the day and the rest of the week.
Oh, yeah.
So we talked earlier, let me just touch on the hairy underside of the Moxa leaves. I have some Chinese colleagues who do a lot of Moxa, and they kind of proudly use something cruder because they say it has the chi of the whole plant. I'll hold up an example. This would be not actually cheap, crude green Japanese Moxa. This they call a 16:1 dried Moxa. So this is, for them, for their standards, fairly refined. You could assume that they're calling a 16:1, that they have a harvested 16 kilos yielding 1 kilo of this dried product here. So it goes through process, this from a large Moxa factory in China. When I monitor, as I've just in the last month been experimenting with this and see what happens with the pulse, it's good. You can't say that there's a problem with this. You can't, roll it with the ease. So you can't really do multiple cones of like half rice. But if you're doing, say, Moxa, like the larger cone, the Koshiishi technique, that would be doable with this stuff. What do you think of this idea that there's something to be said about using all parts of the plant in some proportion or other in a final product? I don't know if I'm just an unimportant question or it's important. I don't know.
I think it's good that that's what I use for horses, and then I think as long as you have like a good ventilation, that's the that's the problem, because the Katai sensei did the research on the safety of the Moxa, and then if it's I think they said I forgot the name, but it's basically the gold Moxa from Japan. Those are like not harmful for practitioner and then patient to inhale,
Yeah.
you know. And then I use the green Moxa, but then, you know, when somebody has asthma, they kind of start coughing, you know, and then so I stopped using it, you know, because I use a lot, you know, and then I even changed the incense stick as well to, you know, all natural incense stick. So I was just, you know, it's just that if it's outside, I think it's no problem. I think that's the maybe only thing we have to maybe pay attention.
I remember when I was actually in the clinic at the school that I studied at, and using a smoky Moxa stick, and I triggered an asthma attack in a patient. It put me off using Moxa for a long time, because I'm thinking, well, this isn't what it's meant to be. But I've got some here that I think is more like, I'd say it's about, it's not 16 to 1, that's for sure. And I bet you it's better than your stuff, Bob. And it's very fragrant.
From China.
No, this is from my back garden.
Oh my goodness.
But I'm not sure if I should say this too loud, but it was plants that were, let's just say somebody brought them into the UK in a suitcase from Japan, and name no names, and nobody can get into trouble, can they? And they survived the journey, plant them in the ground, and they're doing very nicely, and it's been spread around a little bit. These plants are going everywhere. So this is princeps, Artemisia princeps from Japan.
It's a control study because it's only in your garden.
No, it's not, unfortunately. I can't tell the truth if I say that. But I'm not going to tell you where else it is. But it's in people's gardens. We're not sowing it all over the place to make, you know, because it might be regarded as being an invasive weed. It's much tougher than the English, than the European version. It survives the winter. The leaves survive the winter. Our local stuff here dies and it comes up. It starts growing much earlier in the year, but it makes pretty good Moxa, and you can make small cones with it. But my take on the whole plant idea is that the more of the leaf so the first thing is, the first part of the process is get the stalk out,
right,
then get the leaf out, and the dust comes out of it as you're pummeling away. It's quite hard work, and you end up literally, I'd say that's probably not, did you say 16 to 1? I'd say this is probably about 6 to 1. I tried to get it better than that. The best, supposedly the best Moxa from Japan is about 20 to 1, I think. No, 50 to 1. It's 2 grams for every 100 grams, I think you get. So it's
100 kilo, and then you get 1 or 2.
You get 2 kilo. Yeah. 2 kilo. Yeah. I think it's 50 to 1. But this is nowhere near. I know. But what I know is this stuff, because I've got a little bit better at it over the years, and this stuff burns quicker, and it's peak temperature. I did have a measuring machine. I lent it to somebody. I can't remember who I lent it to. So, but Koshiishi Sensei had one. And so you can measure the peak temperature, and a peak temperature with a rice grain cone is definitely, if it burns quicker, you end up with a lower peak temperature. So it's easier to handle, it's safer to handle. And so I think that the more of the whole plant you can get out of it for direct Moxa, for the safest type of direct Moxa, you know, rice grain Moxa, it's very important to get the rest of the plant out and use as much of the hair on the underside of the leaf that remains as possible. If you're using a general smoldering on top of something like you were describing, Yuki, on top of the miso or on top of shunko, that's a different kettle of fish, because then you're not worried about the fast burn, or on top of a needle handle for that matter. You're wanting a nice slow smolder with a nice high temperature. So I think that it's horses for courses for that, personally. You know, but it's work in progress, that is.
I just have caught my eye going to the time. We've been talking for 3 hours, believe it or not.
Oh my gosh, wow.
The time flies. I didn't even mention, by the way, that my brother-in-law is recently retired from the CDC. He's a medical doctor, and he's charged with tuberculosis surveillance worldwide. He's been
Wow.
in India, Africa, Thailand, and for the last number of years in Atlanta at the headquarters. So it's kind of in the family, this connection to tuberculosis, and he's not all that open to alternative medicine. As we speak, he's at a health spa in Thailand, and he's getting all kinds of body work and opening up a little bit to the East Asian medicine side of things. He just received a Chinate-san abdominal treatment yesterday and said he was transported to a different planet.
Wow.
Maybe he'll come around to helping us with this tuberculosis work.
That'd be amazing.
I'd just like to jump in on one thing in that respect, is that I think one of the one of the sort of handicaps that Acumoxa total, forget whether it's Mox or acupuncture or whatever, but let's put it all together, is the evidence base has been shaky because of our approach to it, and because of the way the demands have been on the therapy. It needs to be done, in the gold standard with the RCT and stuff. And so at the end of, God knows, 30 years of fairly constant efforts at researching, we still have got a pretty limited range of approved treatments, for particular conditions. So we're holistic therapies. We don't care about conditions. Well, we live in a real world where we have to care about conditions, because otherwise we can't advance this in the way that we want to. And what we've tried to do with Moxafrica is two things. One is we've taken on probably biomedicine's biggest failure, which is tuberculosis, which should have been eradicated decades ago. There was a vaccine. Talk about vaccines, a hot topic at the moment. 1921, so it's 101 years ago, the TB vaccine was developed, and it's an ineffective vaccine, and they're still looking for a replacement for it. It kills 10 million a year. Sorry, no, sorry, I beg your pardon. It infects, the active disease infects 10 million. It kills probably about 2 million people a year, and yet there's no vaccine for it that's effective. The vaccine is effective at preventing disease in infants, but apart from that, it's useless. Probably the most widely used vaccine in the history of medicine. So it's got a very, very bad track record, and there's been effective drugs for it for 70 years, and the disease is still rampant. So we're taking on, this is primary healthcare at its most, and we've tried to play by biomedicine's rules. In other words, we've gone down the reductive kind of pathway of trying to do this properly. We're trying to do it by RCT. We're trying to demonstrate effect. And of course, one of the major lessons we've learned is one positive study means nothing. You've got to end up to the meta-analysis and all this nonsense. But basically, I think this whole project of trying to investigate whether Moxa really can help with treating this disaster of a disease it's such an opportunity for Acumoxa to embrace and get behind, because of what it potentially offers, to say, well, look, the evidence base for this, and this, but look what it can do for this particular disease, which is not just a chronic disease. It's like arthritis or something like that. This is a killer. This is an infectious killer disease. So I just wanted to put that in the mix, because I'd like other people to hear that and maybe think on it. We need help. We need collective thinking and smart brains to try and take this forward.
Have you thought of working in India? Because
we've tried 3 times now. We've tried getting on the ground in India.
That's what frightens my brother-in-law the most.
Yeah, but India is a basket case, and the Prime Minister of India the legendary Prime Minister of India claims that they're going to actually finish, actually, no, this is before COVID, to be fair to him. He claimed that they would eradicate TB in India in 2025. You know, the guy is off the planet. It's impossible, absolutely impossible. It's never been eradicated in any country on the planet, but in India, with the numbers that they know they have there, and that they officially declare, which are underestimated, not a chance. And they've got so much MDR. It's a disaster area. Yeah.
And you have
Merlin.
even a slum like 1 million people.
Yeah.
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 Yeah. You mentioned about the project coming up, Merlin?
The one, yeah, we've got an opportunity in South Africa that is opening up. And again, South Africa is a lot more open about its MDR-TB, but South Africa is another epicenter for MDR-TB. And we've tried to get to have a sustainable project there and failed. We did two pilot studies actually down there. But Yuki's going in October, isn't it? Next month? No, yeah.
2
Hang on.
months.
2 months time. And we
Yeah.
were talking with somebody down in Durban this morning. So we're hoping to do a project with, it'll be with TB patients who are also homeless and have drug addiction in Durban. And also hoping to pick up links in Cape Town. Cape Town's the sort of center of TB research for much of the world, actually, because people like living there and doing their research down there, I think. Yeah, another mixed up country.
Yeah.
Indonesia. We've tried to get on the ground in Indonesia. It's huge, huge problem.
Yeah.
Well, no shortage of challenges, huh?
Yeah, no shortage of opportunities if we're given them. we've only got a limited amount of Moxa, but we want to put it to use.
Well, luckily it does grow like a weed.
Yeah.
But so I think this is a appropriate place to wrap it up with my deep gratitude to both of you for freeing up your time. I know you're both busy. This has been a rich experience for me to just tap into both your brains and your deep experience and try to deepen my own understanding of Moxa, how to use it, and so on. So, and I hope this generates some interest on YouTube. I'll do my best to push it through available channels. And those who are listening and got this far, buy Merlin's book, donate to Moxafrica. And if you're in Europe, go to Yuki's seminars.
Thank you.
Oh,
thank you both. Thank
well,
you.
Bob, thank you, really, thank you so much for the opportunity of, you know, us having this conversation, and also very much so for asking some pokey questions that we don't have answers to.
Yeah.
Yeah, and
Thank you
maybe,
so much.
Yeah, maybe Najom can help us get the word out as well. Thank you.
Thank you.
Thank you. Thank you.
I'm going to stop the recording. Okay. Bye-bye.